Okay, let's get started. So, good afternoon. My name is Ebony Martin with NAMI New Hampshire. This presentation is brought to you as part of the Onward NH webinar series, supporting the first episode Psychosis Early Serious Mental Illness Initiative. Thank you for joining us for today's webinar titled Rapid Response Crisis Training, a Better Prepared Workforce. This presentation is being recorded and you will be able to find it on the education page of onwardnh.org. In the next couple of days, you'll receive a follow-up email with links to both an evaluation and the recording. This is a Zoom webinar. Your camera and microphone are off. Chat is off, so please enter questions in the Q&A section. My colleague Meredith Closey is with us to help field your questions. Today, we are talking about an important topic for those who may need to utilize the rapid response teams. This training is changing the way our crisis responders interact with people going through crisis and how they care for themselves after responding to crisis. Our presenters will share about the training, the response from people who have taken the training, and the changes being made in response to the feedback shared. It is important to note that feedback is one of the keys to having a better prepared workforce. Due to unforeseen circumstances, one of our panelists, Jessica LaChance, was unable to make it today. Luckily, we have Beth here, and she has worked closely with the community mental health centers and will share her presentation. In her presentation, the collaborative work that they have done and the changes that have been implemented due to the feedback from the centers. After Beth's presentation, we will have Liz Hodgkins, Deputy Director at NAMI New Hampshire, talk about the feedback she's gotten from peers who have done the training. She also worked on the advisory council, and she will share more about her experience with that as well. Now I'll turn it over to Beth.
Thank you so much, Ebony, and good afternoon, everybody. Thank you so much for having me. I am going to go ahead and share my screen. There we go. So again, thanks for having me here today. Again, I'm Beth Grosso, and I'm here as a humble representative of a collaborative team that includes our project co-lead, Macy Muller, and our state partner, Brian Harvey. So today, my hope is that by the end of our time together, you'll be able to list and describe at least 3 components of the new New Hampshire Rapid Response Crisis Training, that you'll be able to describe at least 3 core competencies of this training program, and that you'll be able to identify at least 1 preliminary outcome that we identified from our pilot cohort. Just a note that the full curriculum for the Rapid Response Crisis Training and Certification Program was developed by a team from the University of New Hampshire's Institute on Disability, which is where I sit as the training director, and it was completed in partnership with the New Hampshire Division for Behavioral Health. I like to start my sessions with a moment of reflection. And so I'd encourage each of you to take a moment and think about 1 to 2 benefits of having mobile crisis response available in your community. I think this is helpful in grounding ourselves in the importance of the service that this training is attempting to reinforce. So I'm going to open with a quote as a way of centering the core intent of crisis response. Perhaps the most potent element of all in an effective crisis service system is relationships. To be human, to be compassionate. We know from experience that immediate access to help, hope, and healing saves lives. When you're in crisis, you want a well-trained team to respond. And in order to offer this compassion and hope, we need to offer training that enables our crisis responders to offer that compassion and hope. And so with that in mind, I think it's important for us to recognize the context of crisis response in New Hampshire. And so I'm offering a little background on how the certification training came to be. And it came from a recognized, well-documented, and deeply experienced workforce shortage within our behavioral health system of care. And one of the simplest indicators of success, according to a September 2024 report that was released by a joint task force, was increasing the number of people hired. And not just increasing the number of people hired into the behavioral health system of care, but retaining them. And so enter workforce development. And workforce development is a really broad term that describes a set of programs and activities that are designed to create, sustain, and retain, there's that word again, a viable workforce that can support current and future needs of our behavioral health system. Effective workforce development initiatives lead to increased effectiveness and efficiency, increased productivity, a higher job satisfaction, which leads to increased retention, which leads to positive working environments where people feel like they're working on the same page, that they have a shared set of values. And that leads to increased consistency in our approach. So the New Hampshire Rapid Response Crisis Training is a workforce development initiative. It aims to establish practice standards in crisis response that are shared by all crisis responders across the state, and to equip each trainee with the skills that they need to offer that compassion and hope to every person and family that they respond to in the community. This training program, which we'll talk about in more depth, is aimed at both current and future crisis responders. The three pillars of crisis response are someone to talk to, which represents headrest and the access point, someone to respond, which are our New Hampshire Rapid Response teams, and somewhere to go, which represent crisis centers. The crisis responder training is focused on certifying professionals working within two of the three pillars, and I've circled those in red. Crisis responders on rapid response teams and the professionals who will staff these crisis centers. There are rapid response teams within each of the 10 community mental health centers in New Hampshire, and these teams can respond in any of three ways. In person, by deploying to a community location, meeting the person in crisis where they're at. They can also respond by video assessment or in office through same day or next day appointments. Rapid response teams are made up of an interdisciplinary team of professionals. The gold standard for crisis response is a co-response model that includes both a peer and a clinical responder. This crisis training program aims to add a fourth option to the team, a certified crisis responder. So who gets certified with this training program? Anyone who is hired onto a rapid response team as of July 1st of 2024 is required to complete this training. This includes master's level clinicians, peer support crisis responders, and bachelor's level responders. This certification supplements a peer support role, and it is not intended to replace any prior certification or licensure. Its aim is to establish the professional role of a crisis responder and acknowledging that there are various professionals under that umbrella of crisis responder. This program is also available to anyone who meets our eligibility requirements. I'll outline those in the next slide, because it also serves as a career pathway for those who are seeking a career in the New Hampshire Rapid Response System, and that's part of the Workforce Development Initiative. So who can enroll in this program? There are no minimum education or experience required. Anyone who's eligible to work in the state of New Hampshire can apply. If you are not currently employed on a rapid response team, there is a 2.5-hour pre-employment module that's required, and that provides an overview of the New Hampshire behavioral health landscape and the role of the crisis responder within that landscape. Everyone enrolled in the program does complete a 1-hour pre-enrollment module. This training project is really a result of statewide interdisciplinary collaboration. Our team here at the IOD led the development and ensured alignment with best practice and course competencies. And we did this in close collaboration with subject matter experts from across the state, many members of leadership in our community mental health centers, on our rapid response team, who contributed their expertise to each of the training modules. Subject matter experts represent both clinical and peer expertise. Each training cohort is run by a pair of co-instructors, which includes a clinical and a peer instructor. And this is intended to mirror the co-response model in place within rapid response teams. So we strategically put these bubbles overlapping because in many instances, one individual can serve in all three roles. So the course has competencies, and competencies really help us identify what we want trainees to be able to do at the end of the training course. And it doesn't stop there. They serve as touchstones for continued practice far after the training course ends. The 10 competencies of this course are based on SAMHSA's core competencies for integrated behavioral health and primary care, and they include interpersonal communication and positive engagement, collaboration and teamwork, screening and assessment, trauma-informed care, care planning and coordination, interventions and support strategies, cultural competence and adaptation, a systems-oriented practice, practice-based learning and continuous quality improvement, and finally, technology literacy. I mentioned that crisis response is available via video assessment as well, so having that technology literacy is very important. The curriculum is designed with three core elements. The first is asynchronous coursework, and we host that on our Canvas platform. And that includes about 2 hours per week of a read, watch, do format. So we offer short readings, we offer pre-recorded lectures and related video clips, and then each trainee has a discussion board and multiple choice quizzes each week to check in with their peers from their cohort, as well as to check in with themselves in their learning. We offer 4 in-person seminars throughout the 15-week course. Those are held the first seminar is an hour and a half. That's a kickoff. The 2 middle seminars are 4 hours. We just had one yesterday. And our final seminar is an hour and a half, totaling 11 hours of in-person time. And these seminars are really intended to take what they're learning in the asynchronous environment and bring it to life. Experiential exercises, open group discussions. Yesterday's session talked a lot about disposition planning, mandated reporting, and it was a robust and rich dialogue across the trainees. And finally, on-the-job mentoring. This happens in place at their community mental health center. We have 12 on-the-job mentors right now across our 10 community mental health centers. And so our trainees are connected with a mentor so that they can engage in critical self-inquiry about their progress, achievement of competencies, and their experience with the training. And this totals 56 hours over about 15 weeks. We are a flexible learner-led program, and so the 15 plus asterisk indicates our flexibility in ensuring that trainees complete this training program successfully. I wanted to share some pictures from a recent in-person seminar from our first cohort. And I love these pictures because I think that they depict the spirit and intent of our training. Small group work, engagement, the opportunity for members of our rapid response teams from across the state to come together, connect, and learn together. Topics that are addressed in our 15-week course include team member roles and dynamics. Again, we're talking about an integrated interdisciplinary approach, community resources, an overview of mental health and substance use conditions, engagement and communication strategies, support strategies, of course, suicide assessment and prevention, safety in the field, effective crisis response across populations, and that's really where we delve into topics related to cultural competence. And of course, promoting the well-being of crisis responders. This is hard work, and self-care is an important cornerstone of the work of crisis responders. Certification results in a culmination of successful completion of the following elements. So we see asynchronous coursework in getting an 80% or higher in that Canvas course. in-person seminars and attending at least 80% of those, completing 15 hours of on-the-job mentoring, achieving an 80% or higher on both a written and practical exam. At the end of this, each trainee will receive a New Hampshire Crisis Responder certification and 2 UNH digital badges. I would just want to take another moment to emphasize here that this might seem like a lot, a big hill to climb. And our project team are specialists in trainee support, and we are with these trainees each step of the way, proactively engaging, outreaching, and offering whatever reasonable accommodation and support that we can to support the successful completion of this training program. We are one community. We are one system of care, and we are here to see people succeed. Just a word about digital badges, because it might be the first time that you've heard about that. UNH digital badges are considered a micro credential. And really what they do is they offer tangible evidence of someone's learning. And so trainees who receive digital badges can share them as a live demonstration of the training that they received and the competencies that they're able to demonstrate. So where are we now? The first 2 cohorts were largely focused on our existing rapid response team members. We are currently we are approaching week 13 of our second cohort, and we're looking forward to our third cohort starting sometime in early May. And this is really where we will also begin shifting our attention and placing an emphasis on opening this as a career pathway for individuals who are interested in becoming a certified crisis responder and serving on one of our New Hampshire rapid response teams. This QR code that's on the screen will lead you to our project website where you can learn more and you can also submit an application to enroll. So a quick look at our crisis training by the numbers so far. As you can see, we have trained just about 60 trainees across the state. And at this point, all 10 community mental health centers are represented within these cohorts. In the second cohort, we've also welcomed 2 not yet employed trainees. I also wanted to share some demographic information about the diversity of our trainees. As you can see, we're looking at a range of learners, from people who have their diploma and GED to people who have a master's degree. We're looking right now at a cohort that is largely serving in full-time roles, but as you can see, that's not inclusive of those who serve in part-time and per diem roles. We're also seeing less than a 50% population of trainees that have more than 5 years experience. So in our current cohort, overall, 43% of our trainees have more than 5 years experience. I also have to highlight the success that in cohort 1, 100% of our trainees passed their written exam on the first try within its first administration. And that was a major milestone for our program. I mentioned continuous improvement as a competency of this course, and it's also a value of our project team. We are committed to continuous improvement, and we conduct regular evaluation and feedback loops with our stakeholders. So this includes assessments. We ask each trainee to complete a monthly self-assessment using a competency workbook that they review with their on-the-job mentors. They complete pre and post surveys based on their experiences, and we also ask them for review of our content so they have an opportunity to complete a module survey and give us feedback about what worked and what didn't for each particular module. We also host collaborative work groups that are made up of not only IOD project team staff, but representatives from community mental health centers. And these work groups are focused on the implementation of this program, developing our certification exams, and curriculum revisions, which we'll talk about more in a minute. We also have an advisory council, and this represents a diverse array of stakeholders from across the state that help to inform our program's relevancy and give us feedback about where we can do better. All right, so let's talk about some findings. These are some preliminary findings from our first cohort. As you can see, we saw a 93% overall satisfaction from our trainees, and 69% reported an increase in their knowledge. This is a direct quote from one of our trainees that spoke to the consistent flow of the class, which is really important, especially in adult learning context. We don't need to be spending time orienting ourselves to what we need to do each week. And so we really aim to make this easy and predictable. And so this trainee said that every week they know that they're expected to read and watch the given material, write a discussion board post, respond to a peer, and take the weekly quiz. It's helpful to have due dates that are consistent each week. This outcome deserved its own slide. We saw a 42% increase in self-reported ability from pre to post survey, with trainees' perception that they're able to clearly describe their role as a crisis responder. And not only that, but that they're able to name their role as a crisis responder in relationship to the broader New Hampshire behavioral health system that they work in. And that's part of our integrated care approach, right? While we're training crisis responders, it's important that they understand the context within which they operate, right? And hopefully that will reduce the occurrence of crises if they can connect them to the appropriate resources and services. So to that end, we also saw a 35-point increase from pre to post with trainees' familiarity with local and statewide crisis resources. We saw a 45-point increase from pre to post with trainees' ability to address emotional and psychological needs in community and institutional settings. And we saw a 31-point increase in trainees' awareness of new evidence-based practices and how to implement them. This is going to result in that increased consistency that we talked about at the beginning that we want from a workforce development initiative. And so we're missing Jessica today, but in honor of what she was going to share, I wanted to offer some feedback that we've received from our community mental health centers. We conducted a survey with community mental health center leadership at the end of our first cohort. 86% of respondents indicated that our training program aligns with the strategic priorities of community mental health centers. Some strengths that they noted was the potential for workforce improvement and unified goals and learning objectives. And that unified goals, that theme continues to extend in these anecdotal responses that you see, that it's a systemized way to credential and train peers across the state, clinicians across the state, that the hybrid format of training is really beneficial, that it's New Hampshire specific. It's managed by and representative of trainers from New Hampshire. It creates this consistent base of knowledge, and it offers that opportunity for rapid responders from across the state to come together and establish a statewide community of practice. We're not just going to focus on strengths because there's always room to grow, and that's part of our continuous improvement. So some identified areas for growth from our community mental health centers have been adapted requirements for per diem and part-time staff, and we heard them. In the second cohort, we revised our syllabus and outlined a modified plan for per diem and part-time trainees so that they can successfully complete this training without feeling completely stressed. We also got feedback about the timing and location of our in-person seminars. So we've made measures to make sure that we are being inclusive in where we are hosting these seminars and being mindful about the timing of these seminars. We also heard feedback that we need to speak more directly to the various roles that are represented within the crisis responder umbrella. Those are the master's level clinicians. Those are our peer crisis responders and this new certified crisis responder role. And what are important considerations within each of those roles? We're listening. And so looking ahead, we have a curriculum revision work group that is underway, and we are planning to roll out a revised curriculum for the third cohort that's reflective of the feedback that we've received both from trainees and the community mental health centers. And our focus is going to be improving our sequence of topics, ensuring broad applicability. So again, speaking to each of those specific roles, scaling based on education and experience, and building a consistent storyline across modules. So I'm going to summarize what I shared in a few bullets. So the first is that this training program is designed to provide a dynamic, engaged learning experience, and that speaks to the hybrid format. We did not want to create a fully asynchronous training forum. We wanted to bring rapid responders together and provide opportunities for experiential, hands-on learning. That's what reinforces learning. That's what creates consistency in approaches. Certified crisis responders can be anyone, from an entry-level professional to a master's level clinician. The goal of the Rapid Response Crisis Training Program is to establish a shared set of practices, values, and competencies across all New Hampshire Rapid Response teams. And finally, crisis response requires a values-driven, integrated care approach so that we are offering that humanity, that compassion and hope to each person or family that we're responding to. And so I'm going to stop sharing here, and I'd like to invite my colleague, Liz Hodgkins, to join me to talk about her experience with this project. Liz is a valued member of our project team and also serves on the project's advisory council.
Thank you so much. I, I just really get excited every time I talk about the rapid response crisis training because I feel like it's really comprehensive. And feel like I've been lucky to be part of the process. So as Beth mentioned, I've been part of the project team. I've also been part of the advisory council. And so part of what I wanted to share today, the inclusion of the multiple perspectives, including NAMI New Hampshire's in that. One of the things that as a statewide organization, I think we see multiple or we hear from multiple communities about the difference in what a response might be based on that community. I think that one of the things that this program really highlights is the consistency across the state, that for your family, or as an individual, if you are in crisis, that all crisis responders, all teams are trained in the same way, and that there is a consistency in how what that response looks like. I also think it's really important to, as Beth highlighted, that peers, clinicians, that all members of the team are trained alongside one another. So there's a focus on understanding each other's role, understanding each other's perspective, acknowledging that a peer might bring the relatability of a lived perspective, and that the clinician may bring the clinical evaluation needed to be able to direct the person to what is the next step for their crisis care. So that consistency is really important. Valuing each person's role on the team is really important. The collaborative approach. I think that one of the things that we hear over and over again is, about the difference in all of those communities. But I think that this is a place where we're coming together to have a more systematic approach. And so just to share my perspective in that way, I feel like I've been lucky to work with Beth and the team, and we're happy to, I think at this point, Beth, am I correct, to take any questions that our community might have. We've thrown a lot of information at you, but we feel like it's important for you to understand about all the changes that are happening, about the changes in how people are trained, and why it's important and why it matters for all of you.
Thank you both so much. And if anyone does have any questions, please feel free to put them in the Q&A box and we can get those answered for you.
And Ebony, while
Yes.
we wait for some questions to come in, I have a question. I would love to hear from the audience what they think is most important for crisis responders to know.
They've done a really great job here. I think the other thing is that I know Beth has, oh, we do have something in the Q&A, but as we get Ebony a chance to read that, I'll say that Beth earlier this week joined the First Episode Psychosis stakeholder work group, shared some of this information with that group, and also listened what about what, same question I think Beth asked, how is there more we can learn about first episode psychosis to be able to share with crisis teams? So I thought that that was an important, an important opportunity for Beth to listen about what are the opportunities to hear more about that particular community.
Thank you. So for the answer to the question that Beth asked, Patricia said compassion. And then someone anonymous said, I think that it's very important to know the process. We have had occasions of confusion on who is supposed to do what. And then we have a question from Audra. When will additional trainings be available in the future besides May? And can we count on continued trainings beyond that time frame?
Audra, I sure hope so. And so my encouragement to you would be to go onto our website and fill out the application for enrollment. It's non-committal. We're not gonna hold you to it, but that will put you on our radar so that we can communicate with you as updates are available. We are in a rather unique moment in time right now where we are making decisions about the continuation and how frequently we're going to offer this training course. Because it is a requirement of our rapid response team members, there will be continuation. The exact information is to be announced. So please do sign up to stay in touch with us. I'll put or actually I can share my email address with you, Ebony. We have a team email address. Stay in touch. We'd love to hear from you, and we're happy to respond to any questions that you have.
Thank you, Beth. So I think this one is to answer your question as well, Beth. Carrie says the impact that living in poverty has on our clients' hopelessness.
Carrie, thank you for naming that. So one element of our training is around the social determinants of health. And poverty is one of those social determinants, and it's very important. And this is part of cultural competence as well, as understanding the context within which people live and how those present as everyday stressors, right? And so absolutely, that is something that we are training our crisis responders on to consider. It may not be the reason for crisis that day, but it's a surrounding variable and it's a resource that needs to be addressed. So thank you.
All right, so Patricia says or asks, is there any difference in crisis response between adults and children?
Patricia, yes. And we have a whole module on working with children, youth, and families. And so those specific considerations are addressed because we know our crisis responders are responding to kids, youth. Sometimes they're responding in school settings. And so we're addressing those topics head on. Yes.
Awesome. An anonymous person said, I commend you for the work you are doing to address the mental health needs and workforce shortages. I would love to take the training, but I don't see how I can be impactful or available to do the work while working full time and trying to keep up with my own duties in this understaffed department. I would caution you about presenting this training because it feels more like an effort to get more people enrolled.
I completely appreciate that. And we recognize the barriers. And I just want to go back and emphasize that this training, a large majority of it is asynchronous. It's structured within 15 weeks. Yes. But if you have an interest in participating in this training, we want to hear from you so that we can have a collaborative discussion about ways that we can support your success in this. There are the in-person seminars have some specific days and times attached to them. But again, we are a responsive team that is continuously evolving and revising our approach to meet the needs of our learners. Thank you.
So Ahmed says he just finished the crisis intervention team CIT training for 40 hours. What is the connection or the differences between the two?
So CIT is a training that's specifically for law enforcement. And Liz, I know that NAMI does a lot of work with CIT. So I'm going to stay over here in my lane with the rapid response crisis training and just acknowledge that they are two distinct trainings for two distinct groups.
And I think that's probably about what we can say at this point in time. There is an integration between where crisis teams will work with law enforcement. And I think both of these are different trainings to make sure that each are well prepared and that we are getting people who are in mental health or substance use crisis to the right place, to the connection to the care that they need. And I think that both of them have some shared values, but they are both training real different audiences.
Thanks, Liz. That's a really important point, and I do want to note that part of this training also includes engaging with law enforcement, right? Because that happens. What is the role of the crisis responder? What is the role of law enforcement, right? So we are recognizing that interplay that happens within the community.
Okay, so this one says, I also feel like a part of the cultural competency efforts should include informing political leaders so they are more supportive to welfare directors who are responsible for doing human service work within a government office with leaders who are not knowledgeable about social service and poverty related needs.
And it's a wonderful recommendation for advocacy and building awareness about this. That is very much noted. So thank you very much, because we need support at all levels.
Right. And just a similar answer to our last question about CIT, I think that there are advocacy efforts that certainly have similar values. There are lots of ways that people can become closer connected and understand a little bit better about some of our NAMI New Hampshire's advocacy efforts or other statewide advocacy efforts. But the point is well taken, but it is just, values are similar, but it's just not necessarily in the realm of the crisis training.
Thank you. So, Ahmed, can you clarify what you mean with the last question that you have? Because I'm not sure what you meant by that. If you could retype it and clarify.
Those were some really great questions, though. Absolutely.
I have BJ who says, while I'm waiting for Ahmed to clarify his question, BJ says, I could potentially set you up to provide some training to welfare directors through the New Hampshire Local Welfare Directors Association. I am a board member. I also work closely with the Peer Support Center in Conway.
BJ, thank you for availing yourself and for your offer of collaboration. I would love on a number of levels to connect with you offline, because I also would love to include information and resources around local welfare options. We have a resource library as part of our training because, again, crisis response is about facilitating linkages after the crisis event, right? Identifying what those needs are, facilitating those connections. So we want to equip our crisis responders with the information about resources available. So thank you.
I think it's also a great time for us to note that this webinar session is recorded, and the part of the value in that is that you can share this. The more information that people know about the preparation and the training that has gone into appropriately training and preparing crisis teams, the better we all work together, the better we're knowledgeable of how the crisis system works. So I think it's really important that if people have an opportunity to share this webinar recording with someone that you think might value from it, please do so.
Thank you. Okay, so Ahmed wants to know if we're talking about the same mobile crisis team as the Greater Manchester Mental Health Center. Is it the same team?
Yes. So each community mental health center, and Greater Manchester is one of them, has a rapid response team. Those are the mobile crisis teams. So each of the 10 community mental health centers has one. So Greater Manchester has one. Community Partners that serves Stratford County has one. So each one of our community mental health centers each has a team, and we are training all those teams from each of those centers. Thank you.
And he says, thank you so much for explaining.
Thanks, Ahmed.
All right, I'm not seeing any more questions in the Q&A. If anyone else has a question, please type it in. I saw a couple hands raised, but that function is off. So if you do have a question and you didn't have a chance to get it answered, please type it in the Q&A, and that way we can get your question answered.
I'm going to just share my screen again with it that has our email address on it. Just to make
Patricia says, thank you for this presentation. Wonderful work.
Thank you for being here. Truly, it was an honor to be here. Do you see my screen, my key takeaways screen? Okay, great. So right at the bottom is our team's email address. It's nhrrct.iod@unh.edu. And we're happy to hear from you. Questions, suggestions, resources.
It's been really great to be part of this session today. I really have, as mentioned, I've been really closely involved with a lot of this work, and I just am. It's really, I feel a sense of pride in the improvements to our crisis system in New Hampshire. So it's great to be part of this conversation. And thank you, Beth, for all the work that you do to be able to bring lots of voices together to be able to build a better crisis system in New Hampshire.
Thank you. New Hampshire is an amazing community. We have incredibly talented crisis responders across our state. My job is just to make sure that they can do the best job that they can. So thank you for having me. And Liz, thank you for your partnership. Ebony and Meredith, thanks for inviting me.
Thank you. Thank you so much. And everyone, I just wanted to remind you that this is being recorded, so you can find it on the onwardnh.org website. Thank you all for joining us today. After this, you'll receive an email in the next couple of days. I will include a link for the website along with an evaluation. After you complete the evaluation, you will automatically receive a certificate of attendance. If you have any questions or comments, please reach out to me at emartin@naminh.org. And we look forward to seeing you next time. Have a great day and stay warm.